Welcome to today's Explainer. Today, we're diving straight into a massive bureaucratic shift happening right now in Delhi's healthcare system. It's a change that sounds entirely administrative on paper, honestly, but it fundamentally alters how life-saving care is actually delivered across the city. We're looking at a complete pivot in medical procurement. Think about the last time you, or maybe a loved one, visited a hospital. Before a doctor can hand you a pill, hook up an IV, or even just slap on a basic bandage, an entirely invisible machinery of logistics has to work absolutely flawlessly. Which brings us to a really vital question. How exactly does a hospital get its medicine? It's not as simple as placing an order on a website and just waiting for next-day delivery. No way. It requires a massive, perfectly coordinated effort, and when that effort falters, the consequences are immediate. So, let's start with Section 1, the hidden healthcare supply chain, or the invisible logistics of saving lives. We really rarely think about the crazy administrative effort required to make sure thousands of medical items are exactly where they need to be, literally the second a patient needs them. Picture the sheer volume of supplies an urban hospital burns through in just a single day. We're talking about everything from your basic surgical masks and sterile gloves all the way to highly specific temperature-sensitive medications for the ICU. Every single one of these items has to be sourced, vetted for quality, bought, transported, stored, and then finally handed out to the correct ward. It's a highly sensitive supply chain where a missing link doesn't just mean a lost sale, it actually means delayed patient care. Moving on to Section 2, the centralized buying system, where the focus is on buying in bulk for the whole city. To really wrap our heads around these recent changes, we first got to look at how Delhi has historically handled this logistical beast. So imagine you're tasked with buying groceries, but not just for your family. You're buying for an entire city, off one giant master list. That is a central procurement system. In this setup, a single central authority gathers up supply requests from every single public hospital, clinic, and dispensary across the whole region. They compile this massive list, they haggle with vendors to secure the absolute best bulk prices, and then they ship the purchased goods back out to the individual medical centers. The whole goal here is maximum efficiency through sheer scale, plus making sure supply quality is totally uniform across the board. And this brings us to a really fascinating contrast in philosophy. On one hand, we've got the old way. Central procurement. This is your giant centralized process defined by a massive bureaucracy and bulk buying. On the flip side, we have direct hospital purchase. This one is completely decentralized. It's kind of like giving each individual family their own budget to just go to the market and buy exactly what they need right when they need it. It's a fundamental shift in philosophy, moving all that purchasing power away from a big central hub and dropping it right into the hands of the hospital administrators working on the ground. That takes us to Section 3. Why suspend central procurement? Let's look at the bottlenecks in the system. So the really crucial thing to understand here is exactly why the Delhi government decided to just hit pause on centralized medical procurement. When we look objectively at the reality on the ground, three major logistical bottlenecks stand out as the culprits for this policy shift. First up, crushing supply delays. When you're processing orders for an entire city's healthcare network, the sheer volume can slow bureaucratic gears to an absolute crawl. A request submitted in January might not actually result in delivered supplies until March. Second, and this naturally follows, we get inventory shortages. If a hospital suddenly sees a massive spike in a certain illness and runs out of a specific drug, they couldn't just run out and buy more. They were stuck waiting on the central system. And finally, the administrative backlog. The central authority just got buried under mountains of paperwork, approvals, and vendor management, creating a giant bottleneck that directly hurt hospital preparedness. Let's look at the solution in Section 4, the direct purchase shift, empowering hospitals to buy directly. Let's check out this new policy and see how it builds a completely new operational reality for hospital admins. Under this new direct buy policy, the workflow is radically streamlined. Step 1, a hospital sees a shortage on their own shelves. Step 2, instead of kicking a request up the chain to some central government department, the hospital just calls a vendor directly. Step 3, the supplies arrive. Simple, right? By cutting out the middleman entirely, the whole point is to supercharge emergency restocking. The power to manage inventory is perfectly localized now. If a medical superintendent realizes their trauma center is running low on specific surgical supplies on a Tuesday, well, they now have the actual authority to initiate a purchase and restock those shelves by Wednesday. It's a massive injection of agility into a system that has historically been super rigid. Which leads to Section 5, impact on patient care. Let's talk about the trade-offs on the ground. Ultimately, we've got to ask, why does this actually matter for the folks walking through those hospital doors? Well, there's no perfect solution in healthcare logistics. It really comes down to a strict table of trade-offs. On the pro side, we are gaining absolutely incredible speed in restocking life-saving supplies. That means patients are way less likely to be told a hospital's out of the medication they need. We get faster emergency responses and a whole lot less central red tape. But we have to look at the con side too. We lose the immense financial leverage of bulk, citywide discounts. I mean, if 50 hospitals buy bandages individually, they're definitely going to pay more than if the city bought them all at once. It also opens the door to potential price variations between different hospitals. And honestly, the biggest catch? We are shifting a ton of administrative heavy lifting directly onto the hospitals themselves. Doctors and hospital administrators now have to spend a portion of their resources managing vendor contracts and procurement protocols, instead of just focusing 100% on patient care. As this new policy rolls out across Delhi, it leaves us with one final, absolutely crucial question to chew on. Will direct buying cure the supply chain, or is it just shifting the burden? We've traded the sluggishness of a huge, centralized bureaucracy for the speed of localized control. But in doing so, we've dumped all that administrative pressure right onto the doorsteps of the hospitals themselves. How these individual hospitals handle this new massive responsibility is really going to determine the ultimate success of this whole logistical shift. It's a wildly fascinating evolution in public health administration, and for sure, one we're going to be watching very closely. Thank you so much for joining me for today's Explainer. Keep questioning the systems around you, and I'll see you next time.